Beverly is globally recognized for her innovative scholarship and her passionate advocacy for the right to a healthy life.
General MacArthur is reputed to have said at one point, don't tell people how to do something, tell them what to do and then let them surprise you with the results. And so this was sort of Dr. McElmurry's approach.
She was the ultimate teacher. Not to say she wasn't a good nurse, but it was for her, it was all about teaching. And teaching for her wasn't, here's a body of knowledge that I have that I am going to impart upon you. Teaching for her was really helping individuals ask questions and then find scholarly ways to answer questions.
She established relationships with people in so many countries, and her desire was to see nursing develop and elevate into its potential in so many countries.
So I grew up in a small town in northern Illinois, oldest of 4, brother, 2 younger sisters. I think a very protected environment. Went to school there, sort of an unconscious childhood, I think. I had 2 high school counselors, basically, who always thought I should go to college, but I didn't have very much money. I had always wanted to go to medical school, but that was so expensive. So eventually I thought, I'll go be a nurse. Then the other counselor, her father died and she inherited some money. So she said, if you go to college, I will give you a monthly stipend to support that, and you in turn will then help others. So that's what I did. I tunneled on off to Minnesota and did a bachelor's and a master's in nursing, and of course there were traineeships. I worked part-time. During the time of the master's, I had been recruited to teach at a innovative little junior college. It was very new. The quote, technical professional dialogue was going on. So I was going to go to the technical school. You know, this was called St. Mary's, this little private school that was doing this. And we had routine meetings with the university. We spent a lot of time talking about how does the associate degree relate to the professional degree, how do these two work together, you know, really experimenting with how you taught, but when you did lectures, when you did groups, when you did labs, all that kind of stuff, and probably pretty successful. So then I decided to move to Madison. It was like a 9-month appointment. So every summer then I worked in intensive care at the university hospital. And I had my epiphany in Madison. The university hospital was the referral site for the whole state. So you'd see these really sick people come in. One day I just looked around and I thought, this is really stupid. Nobody can tell me what health is. So I left a doctoral study and decided I'm going into community health and I'm going into health promotion, and I am not going to study disease anymore.
I met Bev in 1981. She was a tremendously creative person, and she brought out that in me in a way that I wasn't aware of. And together, we thought a lot alike. Together, we had great ideas, and we did great things, and we convinced people of the things we were going to do so that they would fund us or publish us. Bev's agenda was so broad. She was able to put concepts together in a way that I think I'm pretty good at, but I've never seen anybody do it like she does. And that's why she could do work in history and in economics of nursing and in nursing ethics, some substantial work in nursing ethics, and in global health and in women's health, because there were themes for her. And she didn't talk about them a lot, but if you spent time with her, there were themes across all of those. And those themes had to do with human rights and autonomy and creativity and social justice, probably. And she liked recognition for her work, but that was less important to her than almost anybody else I know. She was really happy to see those around her get recognized, and particularly students. I would say most of the work I watched Bev do over the almost 30 years I knew her, she was always about 10 years ahead of the curve on whatever it was. You know, you say it now and people say, oh, community-based participatory research. Of course we do. Everybody does that. NIH is funding that. But, you know, when we were working on this in the 80s, nobody was doing that. And listening to community women and having them tell their stories and having them come to the table as a part of planning for the health of their community, because they were the ones who were going to be there 24/7 and influence children and spouses and partners, was extremely radical. And even as I'm saying it, it sounds like such a, of course, but it wasn't. It wasn't. It came out of a marriage of women's health and primary health care with the idea of empowerment. So it was all about empowerment, whether it was women or communities, or it was all about giving them voice. And we did these pretty far out, fringy projects where you had people from the poorest communities in Chicago, people that didn't speak English, people that came from Robert Taylor homes, which is gone now, but in 1988 I think it was declared the poorest community in the country, coming into the university, meeting with physicians and nurses and dentists and sociologists and learning from them and sharing knowledge with them about their lived experience, and then taking that back and trying to do global change. And we weren't sociologists, we weren't activists, we were nurses. Most people think of nurses in institutions, and we were out on the street. And Bev wasn't a street person. She wasn't comfortable in that, but she was comfortable with the concept. And we had funding from a local funding agency, and she said we were her lunatic fringe project, and she had to check in on us every 4 months to make sure that we were okay, because this was so outside of anything anyone was doing in healthcare at the time.
That's really true. Bev, as far as I know, was the very first person to ever try to hire someone in the university who did not have a high school diploma. And that was a big challenge for the administrative system. We brought women from the community who most of them had never really worked at a formal job before. And one of the things we learned very quickly was that they needed a lot of life lessons in how to work and how to hold a job. So we learned from them and they learned from us. And that project was truly fascinating and a real adventure, I think, for all of us. One of the first problems that Bev faced was convincing people that it was okay to try this model without having any really strong outcome measures of exactly what you were going to accomplish. Her approach was that the problems would come from the community and would be identified collaboratively by the health worker and advocate and the rest of the community. And then, after they had set their goals, we could then think about what those outcomes might be and how to measure them. So this later developed considerably, and there's today quite a formal research methodology around participatory research. But at the time that Beverly was beginning this work, it was really quite unknown. I've personally taken that to Malawi and Botswana, where my HIV prevention projects have used that same approach, where we have health professionals and community members. You know, I think part of it for Bev stemmed from her own life experiences. She started out as a critical care nurse, and she very quickly decided that it wasn't the place for her, and that it also maybe wasn't the place for health care to be centered. Another really important factor was that Bev had an amazing trust in the capacities of people. So she believed that women who had never finished high school and had had their first baby at 15 had an insight into how life evolved in their community that could be helpful to health professionals who wanted to help them improve their lives. I think she connected the issues of the nursing profession with the issues of gender inequality.
I remember asking several people, where's the WHO Collaborating Center, and they sort of scratched their heads and they said, I'm not sure, but you better go speak to Dr. McElmurry. So I remember wandering up to the 11th floor, and she was in her office where she often is, and I sort of stuck my head in the door and gave her a quick rundown on who I was and what I was doing there, and she looked at me and she said, "You want a job?" She became my instructor after she became my mentor, because like while I was still an undergrad, she got me involved in the Minority International Research Training Program, both as a participant and as a program assistant. The MERT program was a program to help nursing undergraduate and graduate students from all over the United States to learn about research by going abroad and assisting a faculty member at another university at an international site with a research project for approximately 12 weeks. And so we had students from colleges of nursing all over the United States applying to be MERT scholars, and then we would accept a certain number of them into the program, and we had partners at international sites, colleges of nursing, and we would pair each student from the U.S. with a faculty researcher at one of these foreign colleges of nursing. For Dr. McElmurry, international collaboration meant more than sending American scholars abroad to implement their research or to conduct research. It was a process of bringing expertise from abroad back to the U.S. and having international sites be places where students could learn about research. So I think the idea was to build bridges with other colleges of nursing. I went to Indonesia, and it gave me the chance to see what kinds of research were happening in that country, and also to learn what the research process was like and how it informed practice. This was like being thrown in the deep end of the pool. So I had done some reading and studying prior to going to Indonesia, but shortly after I arrived, I was studying like cultural diplomacy, international relations, how to be street smart as a young American abroad. It gave me a different view on what nursing means, and I felt that I was part of a kind of my sense of who I was as a nurse expanded a lot because of being in that. I saw myself as a member of a group that was international. So when I thought of my classmates, I thought of people in the U.S., but I also thought of people in Indonesia. Well, she was the one who created these opportunities for me, but second of all, she was the one who encouraged me to start to build on some of these relationships and to start to think about what those experiences meant for me personally and professionally. And she has always done that. Since then, I've been to Thailand. I've been back to Indonesia. I spent last summer in the Philippines with the RA for nursing who was a colleague of Dr. McElmurry's. So all of this international travel and learning about and practicing nursing and nursing research in these other countries was an outgrowth directly of my relationship with her. So I thought of her as being a mentor who could outline some kind of broad ethical imperatives and talk about the historical origins of those, but then it was up to you to figure out what that meant. For me, it was really the best kind of mentoring, because it was constantly an intellectual challenge to kind of figure out how to bring those principles to bear on whatever I was doing. She was a straight shooter, and she had a low threshold of tolerance for kind of BS, and that I really liked that about her, and I don't know if that, I don't know what to attribute that to, but there was a comfort level that I had working with her where she was very pragmatic. She was about getting things done. It was by going to other countries that I realized how influential she had been, because I would mention her name somewhere like China or Indonesia, and people would say, "Whatever you need, whatever I can do for you, please let me know." So her bearing her imprimatur would open doors for anyone.
I think something that's just pervasive in the pores of this college now is our interest and delight in working internationally. I think it's not unique necessarily, but it's rare in colleges of nursing to have this much of a international linkage. And I really think that if it weren't for Bev, we wouldn't have it. And it's probably the thing I value the most about this college. The ways that I grew as a scholar and a nurse were things that I had never expected to get involved in my whole life. And it was sort of serendipitous, but it was, you know, you could see Bev's hand in things. She guided a lot of the times sort of by remote control, or she'd just plant an idea and then watch and nurture until it took seed. I had already started the postdoc, and she said to me one day, you know, this postdoc is going to involve a little bit of international research. Is that going to be a problem? And I just stopped and I went, well, does that mean I have to move to another country for a year? Because that might be a problem. If I hadn't had that prodding, I wouldn't be doing at least half of the things I'm doing now that have been so fulfilling and wonderful. She kept her mind open for opportunities, and she was a person that could pull the ideas together. She had a big picture, and she could make linkages. And so she would see a possibility and move on it, see if we could actually develop something, and pull in people that she thought would be good to work on that. And just, she kind of masterminded a lot of things, but she led by sort of by example, but also by just pointing out what could be done, and then just sitting back, and if you didn't move on it fast enough, she'd give you some prodding, but that was definitely an instigator. I don't know how many people would say that they can still feel Bev's foot kind of in their back, but I'm certainly one. The people that she affected went back to their homes with a new sense of themselves as nurses, with a new sense of what nursing can contribute. Every chance she got, she made the point that the largest number of healthcare providers of any profession are nurses.
I think that Bev has left us a way of working that integrates our philosophy, our ethics, our sense of engagement in the world, our respect for other people, and our excitement about learning things.
All of her students, I don't care if they went into something totally unrelated to anything Bev has ever done, will always remember her and will have a different sense of themselves in the world and of what nursing practice means and what nursing means in the world because of the work they did with her. They will think differently forever. And if you're a teacher at heart, boy, that's all you can ask for.
I was moved by her really unflagging commitment to students, how committed she was to advancing nursing scholarship in other countries and to bringing students here to learn, and then supporting the advancement of the profession in other countries.
So I think there are lots of ways I wish I could be more like Bev, and I won't be able to. But in the ways that she's inspired me in the past, I'm sure she'll continue to do, and I appreciate that.
Do not stand at my grave and weep. I am not there. I do not sleep. I am 1,000 winds that blow. I am the diamond glint on snow. I am the sunlight on ripened grain. I am the gentle autumn rain. When you wake in the morning rush, I am the swift uplifting rush of quiet birds in circling flight. I am the soft starlight at night. Do not stand at my grave and weep. I am not there. I do not sleep. Do not stand at my grave and cry. I am not there. I did not die.